Good morning, Sean Paul. I am Mihiraa. Let's start the warm-up sessions. What motivated you to pursue a career in medicine?
I became a doctor because of my strong desire to help others and make a real difference in their lives. Witnessing the profound impact healthcare professionals had on individuals and communities inspired me. Whether it was relieving pain, providing comfort, or promoting better health, these experiences were deeply fulfilling. The dynamic nature of medicine, the endless learning opportunities, and the chance to collaborate with diverse teams also drew me in. Ultimately, becoming a doctor was the most direct way for me to pursue my passion for serving others and creating lasting change.
Why did you choose OT?
As a doctor, my ultimate aim is to practice medicine in an English-speaking country such as the UK or Ireland. To attain registration as a medical professional in these nations, I must demonstrate proficiency in the English language. Therefore, I have chosen to undertake the Occupational English Test, OET, as it is specifically crafted to assess the language skills essential for healthcare professionals. The tailored nature of the OET ensures that it aligns closely with the communication demands and scenarios encountered in medical practice. By opting for the OET, I am confident in my ability to meet the language requirements and pursue my dream of practicing medicine in an English-speaking environment.
What are the current trends in your profession?
In my profession as a doctor, several trends are prominent. Telemedicine has seen a surge in allowing remote consultations. Personalized medicine is gaining ground, tailoring treatments to individual patients. Preventive care and wellness promotion are increasingly prioritized. Advancements in technology, like AI and wearables, are reshaping diagnostics and treatment approaches. Keeping up with these trends is essential for providing optimal patient care.
Do you have a role model?
As a doctor, I find inspiration from various sources, but if I were to pinpoint a role model, it would be Dr. Paul Farmer. His dedication to providing health care to underserved communities worldwide, his commitment to social justice, and his innovative approaches to tackling global health challenges serve as a beacon of inspiration for me. Dr. Farmer's work with partners in health demonstrates the profound impact that compassionate and equitable healthcare can have on vulnerable populations. His tireless efforts remind me of the importance of empathy, advocacy, and persistence in my own medical practice.
Which is your favorite destination? Why?
As a doctor, my favorite destination would have to be the United States. The reason is the vast opportunities for medical advancement and collaboration available here. The USA boasts some of the world's leading medical institutions, research facilities, and healthcare innovations. Additionally, the diversity of patients and medical cases encountered in the U.S. provides a rich learning experience and keeps me constantly challenged and engaged in my profession. Overall, the United States offers an unparalleled environment for medical professionals to thrive and make a significant impact on the field of healthcare.
You can now start your OET roleplay.
Good afternoon. I am Dr. Sean Paul. How can I help you today?
Doctor, my 3-year-old son was stung by a bee while playing in the garden. I'm extremely worried because my nephew had a severe allergic reaction to a bee sting last year and had to be hospitalized. My son has a large red swelling on his arm and he's in a lot of pain. Can you please admit him to the hospital for observation just to be safe?
I understand your concern. Please don't worry. Let me have a look at your child. Can I have your child's name, please?
Yes, his name is Murphy.
Being a parent, and especially given your nephew's experience, it's natural to worry about your son. I've examined the swelling on Murphy's arm, and while it's quite large and he is in pain, these are typical reactions to bee stings. Since he is not having any severe allergic reactions, I don't believe hospitalization is necessary at this point. Hospital admission is usually reserved for more severe cases, and I think we can manage this effectively here and at home. Let's focus on keeping Murphy comfortable and monitoring him closely.
No, doctor, I can't understand your words. But how can you be sure that he will be all right?
Don't worry, it's completely normal to feel nervous. Let's relax for a minute, and then I can explain everything in more detail. What would you like me to call you?
All right. Well, you can call me Mihiraa.
I completely understand why you're worried, Mihiraa. Your son's swelling and pain are concerning. It's been half an hour since the sting, and we haven't seen any signs of a severe allergic reaction, such as hives, wheezing, shortness of breath, or weakness. These symptoms typically show up quickly if a severe reaction is going to occur. Mihiraa, your son's response seems to be localized to the sting area, which is a good sign. This means his body is reacting in a typical way and not showing any systemic illness. This should help reassure you that he is not currently at risk of a severe allergic reaction.
What if he develops a severe reaction later?
I understand your fears, Mihiraa. Since your son is not showing any of those severe symptoms now, it's very unlikely he will develop anaphylaxis later. Yes, Mihiraa, severe allergic reactions usually occur within minutes to an hour after the sting. I recommend observing him at home for the next 24 hours.
I'm still really worried. What should I do if something happens at home?
I understand how frightening this situation must be for you, Mihiraa, especially after what happened to your nephew. However, I feel confident that he can be safely observed at home. Here's what we can do to help him feel more comfortable and ensure proper care at home. First, applying ice to the sting site will help soothe the pain and reduce the swelling. Wrap some ice in a cloth or use an ice pack and gently apply it to the affected area for about 15 to 20 minutes at a time. This can be repeated as needed throughout the day to keep the swelling down and manage his discomfort. Next, it's important to keep the area clean to prevent any potential infection. Gently wash the sting site with soap and water. This will help remove any remaining bee venom and reduce the risk of infection. After cleaning, you can also apply an antiseptic if you have one available. If he experiences any itching or further discomfort, an over-the-counter antihistamine like Benadryl can be very effective. This will help to manage the itching and provide some relief from the swelling. Make sure to follow the dosing instructions on the medication, as they will provide the correct amount for a child his age. I know it's difficult not to worry, but these steps will help ensure he is comfortable and safe. If at any point you notice any severe symptoms developing, such as difficulty breathing, swelling of the face or lips, or if he seems unusually weak or faint, please bring him to the emergency room immediately. Your vigilance is important, and if you have any concerns or questions, don't hesitate to call the clinic. We are here to support you and ensure your son's well-being.
Okay, I'll do that. Thank you, doctor. I just want to make sure he's safe.
You're doing the right thing by being vigilant. I wish Murphy a speedy recovery.